It's 2025, and there are children in the world dying because of lack of proper nutrition. This is unacceptable for countless reasons, but primarily because this is a solvable problem, a problem that should not exist in the first place. The creation of the UNICEF-led Child Nutrition Fund is the answer to addressing this problem. The CNF is an innovative model that unites governments, donors, and partners to revolutionize the way nutrition is funded and implemented. The CNF exists to reach 320 million children and women with high-impact nutrition support every year by 2030. The CNF works through an innovative three-window financing approach that coordinates global investments, doubles domestic contributions, and strengthens local supply chains to ensure a sustainable access to essential nutrition.
Nutrition was something that was so foundational that we needed distinctive work in order to tackle it, because it became very obvious, and it seems incredibly obvious now, but wasn't so clear at the time, that if you're not properly nourished, then you're not going to learn at school, you're not going to develop and grow properly, you're not going to be able to take advantage of vaccination in the same way. So it was something that we knew we needed to properly accelerate progress on. Part of the secret of this is that we're working with countries in a way that we share some of the responsibility, so we use match funding, and it's amazing to see countries now say, we will invest this number of dollars in this, and we will match it as the Child Nutrition Fund, and that has really expanded the number of children that we can reach and support.
And we have seen successes. In the last few decades, we have all reduced under 5 mortality by half in just 2 to 3 decades. We have reduced the stunting by 1/3. So we know that these solutions work, especially now that overseas development assistance is declining. It's very important that our efforts are aligned. So what the Child Nutrition Fund, as the Baroness said, aims at all partners aligning their contribution, their investments into activities that we know yield results. What the Child Nutrition Fund does is take to scale and sustainability by ensuring that the programs are owned by government, and it incentivizes governments to provide domestic resources to nutrition.
CNF in the Philippines aims to scale up high-impact actions, specifically in complementing government funding. And this aims to increase the percentage of our pregnant women who are receiving the multiple micronutrient supplement, MMS, because we need to increase our coverage to 70%. And this is part of our comprehensive maternal nutrition package that is delivered using the antenatal care services. Now, the CNF also complements our government investment. We have this household convergence scorecard. This is a community-based monitoring system that is supported by an information system where the community leaders, the workers can actually track how they are performing in the different indicators for the nutrition services.
There is no doubt that proper child nutrition is fundamental to the whole of the development agenda. It is essential for poverty reduction, for getting health, and also economic gains. And it's also important to highlight that these benefits aren't transient, they are multi-generational. We know from evidence that children who are malnourished are well-nourished, are 33% more likely to escape poverty, to have higher income, learning opportunities, and to fuel economic growth. Despite all of those benefits that are known to us, at any given time, there are 45 million children around the world that are acutely malnourished. This is unacceptable because we know there are known solutions that are cost-effective, and we can actually scale them up. We had governments who started matching us 1-to-1 and are now matching us 4-to-1. This is exactly what we want to see in terms of domestic governments taking ownership and really paving that path towards resilience.
For Ireland, the fight against hunger and malnutrition is a top priority for our development programme. It makes development sense, but it also resonates very, very clearly, as many of you will know, with our own history. And we have also prioritised the scandal of acute malnutrition among children. We have said it for years now, and yet today we see on our screens young children and babies suffering from acute malnutrition while under bombardment in Gaza from an expensively armed modern military. We see children, we don't see as much, but we know children in Sudan are suffering from child wasting because of the competition between warring parties that put their competition ahead of the needs of their people. This scandal, which is what it is, has to end. We have to act differently. We have to put women, children, and communities at the heart of our work to end it.